chances are big that you recognize this pain pattern, which is characteristic of the gluteus minimus muscle. I've discussed why you have this pain and how to stretch the muscle in another video. In this one, I want to show you a very effective technique to relieve the pain using an EMS electrostimulation device. Welcome, I'm Olivier Girard, ergonomist, posture therapist, author of the Posture Manual and creator of 3 online posture programs. I'm not going to say too much on the causal factors for the pain, but check out the other video which I link in the description. Today we just want to focus on where to plug the electrodes and which program to choose. The device that I like to use is this one. It's the Beurer EM49. I like it because 1, it's super cheap, around 50 bucks, and 2, it's super programmable. You see, if you want to plug the electrodes properly, you should be able to recognize more or less where the muscle goes. Without being a specialist in anatomy, you can still recognize it by locating a few important points. You see, when you go here around your hip joint, there's a bump. Yeah, this bump is called the greater trochanter. Okay, the other spot which is important, or line which is important to recognize, is this one here. Yeah, which is the crest of the pelvis, the upper crest of the pelvis. And basically you go a bit above the lowest point, a bit below the upper point, and in that small space you have the gluteus minimus. So you see, it's a small muscle, it's called minimus, and we'll have to stick the electrodes in this space. Of course, unless you have very small electrodes, which is not the case of the Beurer EM49, well, we will go a bit beyond the borders of the muscle, but we want the electrodes to be on top of the fibers though. So here is the crest, here is the greater trochanter, and you see, if you take a vertical line like this here, we want to place one set of electrodes here and there with like 2-3 centimeters distance in between the two. So one center of the electrode will be here, the other center of the electrode will be there, and same on the other side at the back of the femur, one electrode here, one electrode there. So this is one channel, this is the other channel. You see, with my greater trochanter being here, it will look kind of like this, here and there. This is the placement of the electrodes. To these 2 electrodes, you're going to attach one set of cables, yeah? And to the other 2 electrodes, you're going to attach the other set of cables. And then we'll program the Beurer. You see, I'm going to turn it on, and I'm going to go into the menu to choose EMS. From there, I will choose 33, which is the programmable program. I'm going to choose a frequency of 2 Hertz, a duration of the peak of 250 microseconds, and the duration can be 20, can be 30 minutes. Once the electrodes are plugged, well, you can adjust the intensity, which of course doesn't work here because nothing is plugged. The rule is that you should feel no pain. You should feel that something is happening, but that something should not be pain, and you should not see either the muscle jumping. The intensity will depend on where the electrode is placed, on how old is the electrode, and on many daily factors, such how much tension you have. Okay, so if you're at 13 one day, well, it can be that you are 20 the next day. And what you will see is that when the muscle relaxes, you may have to reduce the intensity to keep this feeling of, well, basically having no feeling or barely any feeling. The rule is no pain, because pain will create contraction, and contraction is exactly what we're trying to go against. For several patients of mine with hip osteoarthritis, this has also worked well at a symptomatic level before the operation. So they need to replace the hip joint, but before that, well, this helps a lot relieve the pain. Try it out and let me know in the comments how it has worked.